over the course of the first year, you're definitely going to find something that interests you. My concentration was epidemiology. That's definitely what I was most interested in. I took advantage of the electives, especially the infectious disease. They had an epi of infections course. I took that. I was very interested in it. It gave me the fundamentals I needed as far as terminology and disease background. And I used that to apply for an internship at the Erie County Health Department doing disease control and surveillance. And they threw you right into the mix there. You start interviewing salmonella cases, E. coli. You just try and generate any common trends between cases as far as food history goes, common exposures. And since I've been there, I was lucky enough, the job opened up and I'm still there, so I'm going to take advantage as long as I can. But since then, like everybody's been saying in the panel, every day is different. You never know what you're going to come into. And, you know, since I've been there, we've done investigations with E. coli and had a major role in tracing that back to spinach, lettuce fields out in the West Coast and all sorts of things like that. And, you know, I wouldn't trade it for anything. Make sure you take advantage of every course. Some things will interest you more than others, but definitely take something from every course because you never know when you're going to need it. You can't escape biostats as much as I tried. We always are going to use that. I remember it was maybe a gloomy day in winter and Dr. Rose started talking about rabies. And I never knew why he was talking about rabies. And now I have a major role in playing rabies investigation every day. We're tracking down animals and offering prophylaxis to people who are bitten and people who need treatment because it is a fatal disease. And now I know that. So, but definitely take advantage of field training because the internship is invaluable. You're going to, create partnerships. You're going to learn so much more information than you can from a book. So definitely take advantage of that. The integrated project is very important. Just gear that towards your interests, and it's going to develop. What I did my field training in was the disease surveillance, and my integrated project was with Legionella, which is an infectious disease. It's a bacteria in the water, and it really does. What I did was I developed a grant to test the water supply, the community water supply, to see how much Legionella is in it in anyone, like a cross-sectional study. And it really does, until you do that, you don't realize how much you've learned in the past 2 years. You have to combine all of your core competencies, all of the terminology that you learn, all of the information into that integrated project. And you really do become an expert, like Dr. Bertram was saying, in that particular criteria. So it's a great program. I wouldn't trade it for anything.